So initially we saw non-pharmacological parent-trained behavior management where you use reward principles in the management of ADHD. Second is sensory integration. The evidence base is less and we should use with caution. Then accommodation. Then CBT and cognitive remediation. So CBT is cognitive behavior therapy. So which population it is commonly used? Even though there is no direct evidence, it is commonly used, and especially in older children and adolescent population. Okay, here they address mainly the comorbids of ADHD, improving social skills, because the children with ADHD, especially in adolescent age, has lots of social communication difficulty and poor executive functions, time management. So as a part of CBT, they can address this. Problem solving, okay, they will be totally confused. We help them into write each problem and try to write solution for each problem. First pick up the problem which should be sorted out immediately, then which is the most concerning problem, then work up solution for that problem. Like that, there are lots of problem solving techniques. So this is done as a part of CBT. Okay, dealing with and expressing the feelings. Many a time they'll be too impulsive or sometimes they'll be too withdrawn. Okay, when they have lots of negative conditioning from the environment, sometimes they become very withdrawn. So they have to deal with the feelings. So otherwise they will end up with a depressive episode. And self-control to improve impulsivity and anger management. Both these things will improve impulsivity in the adolescent age. Okay, so these are the broad target of, there are other targets of CBT as well, but these are the broad targets of CBT, especially in older children and adolescent, mainly to address comorbidity and some of the core symptoms of ADHD in older children and adolescent. Okay, this is CBT has lots of evidence in ADHD management in older children. Cognitive training. Okay, cognitive training is basically doing activities involving various types of attention, sustained attention, selective attention. There are so many subtypes of attention. The cognitive training basically involves set of activity that improves particular type of attention. Okay, so basically for cognitive remediation, the evidence is less, like I said, in terms of sensory integration. But unlike sensory integration, cognitive remediation can be practiced at home with the less therapist involvement. Okay, they can guide parents to practice cognitive remediation. Is basically parent mediated. So if it is cost effective, we can try cognitive remediation and see if there is any clear improvement in symptoms. We cannot recommend for all children with ADHD. If the parent wants to try non-pharmacological, if they want to practice cognitive remediation, even though it is has less evidence base and it is currently not recommended by any guidelines as such, we can practice cognitive remediation because it is simple and cost effective. Like like I said, in accommodation, the parent can practice cognitive remediation with clear deadline. Okay, if the child is not improving, we have to switch over to the other methods of intervention. Okay, so this is about non-pharmacological interventions of ADHD. Medications, I'll give a brief overview. In the subsequent section, we will see in detail about what are the evidences and side effects, all those things we will see in detail in the subsequent section. Level A evidence, as per American Academy of Child Psychiatry, modified Texas algorithm is given for the treatment of ADHD, and it is most underutilized mainly because the parent refuse management of ADHD with medicines. Considering the chronicity of ADHD, high rates of comorbidity and lots of dysfunction, especially in the adult age, the pharmacotherapy for ADHD is considered, especially when it is impairing.